Hello, everybody. Welcome to today's webinar that we're going to be discussing why patient portals matter and most importantly, what are we going to do when we're looking into one? My name is Brian Janusa. I'm the Senior Sales Engineer Manager over here at Nextech. And before we get started with the kind of formal agenda, I'll show that to you in just a moment. Just wanted to cover very quickly what my background looks like inside Nextech because it's going to directly relate to this discussion we're about to have. I've been with Nextech now for a little more than 14 years. Actually, coming soon will be year number 15. And over that course of time, I've served many different hats, most notably 3 different kinds as it relates to this discussion. The first thing is I acted as a support personnel, taking live phone calls, assisting our customers with any questions and helps and how-tos. Over the years, I've transitioned to more of an implementation specialist, a training type role, whether that was virtually and or on site as necessary to help implement those products. And today, I'm going to act as our sales engineer, where essentially what that means for everybody on the call means I'm going to be able to show you the product, talk about the history of things, and really let us understand how this works for our workflow. The reason why that's important is patient portals over time, especially 14 years, but really in the last 2 or 3 years have really changed and been enhanced. So I can really give us that perspective of what it looked like from, let's just say, start to now. We're not going to say end because I think we're always evolving. Now, with that said, just as a quick agenda as to what are we going to be discussing on today's call? We're going to first talk about the patient experience, the patient expectations, really the lens of the patient is going to be our first thought of topics here. From there, we'll change and we'll talk about what does it mean for our practices, specifically staff, productivity, efficiencies that will come in from that. We'll then talk about how we can improve financial performance using such things as like an online bill pay method through a portal. Then last but not least, I'm going to actually walk you through the portal. Now, one thing as a reminder, during today's call, if and when you may have any questions, feel free to use the question section in GoToWebinar. And then what I'm going to do is at the very end of this webinar, I'm going to open it up for live Q&A and I'll be able to look through our questions and hopefully give us some positive answers with those. So remember, use that live Q&A section in GoToWebinar if any questions come up. Without further ado though, let's start with the patient side. Let's talk about their expectations, known patient experiences, kind of see where we go from there. So first things first, I wanted to start off today with really kind of a level set of understanding. I think most of us on this call today realize this. If we don't, I think after today's call, we're going to definitely realize that. But patient portal adoption rates, they impact our business whether we like it or not, right? The more patients we have using it, the better arguably our efficiencies will be, which is why we're here to talk about those things. And likewise, if our patients are not adopting it, that has a negative impact on things. I'm talking about possibly seeing more patients. I'm talking about maybe having a reduction in time to reduce our AR. Also reducing things like patients being sent to collections. These are all things that patient portals can help with. So just to kind of start off, I wanted to start with that exact quote, which is an increased patient population, or excuse me, an increased patient portal adoption impacts business results, including higher average patient pay yields, an increase in patient account receivables, and reduced accounts sent to collections. Very important, and we're going to see that more as we go through here. From there, I think we also have to acknowledge on today's call, just kind of what I was alluding to just before, patient portals are becoming that, as we're calling this, technological catalyst that's allowing patients to interact and communicate more with us. And that's going to be important because, again, if we talked about portals 10 years ago, most of them didn't exist at the time, and those that did have very minimal features. They've really evolved, especially over the last 2 or 3 years. So it's really opening up new doors that we never had access to, both on the patient side and on the practice side. Now, since we're talking about patient expectations first, what do patients expect? That's going to be the ultimate question. What we found is from a top 5 standpoint, what you see on the right-hand side are going to be what most patients are expecting. Looking at these items from the bottom on up, you're going to see that one of the kind of least important things for a patient, although I would argue it's still important, But on the bottom of our list is going to be the ability to self-register or self-check ourselves in, right? Patients want to be able to say that they're actually here and do everything themselves. From there, patients are starting to ask more about self-scheduling options. Coinciding with that, they're looking for more like appointment reminder options to confirm their appointments. We then go to provider communications, which I think, again, the start of portals is really through here, like secure messaging and be able to communicate. I think it's gotten better though. And then overall, they're just looking for just a general patient portal experience, whether that is things like online bill pay, whether it is things like filling out their own intake forms or uploading identification cards. There's a lot that kind of goes into that bucket. But overall, patients are just expecting more. And we're going to see why that is in just a little bit. What we found, and this is an interesting number, 40% of patients are not even accessed or offered access to a patient portal. 40%, not even offered it. So why is that? Is it because the practice doesn't have a portal? Do they maybe feel the portal they have doesn't help the patient for what needs they might be facing? Is it maybe a training issue, right? Maybe we have a portal, maybe it has great functions, but our staff is used to not offering it in the first place, and maybe that's what happens. But if you look at that, 40% of patients essentially walk out the door with no access to a portal. That's an upsetting number if I had an opinion here. Even more upsetting, the patients that do get access to a portal, so that 60% number, the difference there, 57%, more than half of them said they didn't even use it because they didn't have a need to. So that's very interesting as we go through today, especially as we relate it to NextSix patient portal, is we got to start thinking about what do they want, what do they need, going back to that original list I was just presenting you, that self-scheduling, the registration, the appointment reminders, and there was a lot more to it, and we'll see more in a minute. But what we found, more than half the patients that get access to a patient portal, they don't even use it. So what we're going to see is, well, maybe if we offer them the right functions and features to not only help us, we can help them. And that's going to be the whole point of today's call. Now, the whole point of the portal is to hopefully offload some of the work on our staff and put it on the patients. So we're going to empower them to be able to go online, to register themselves, maybe sit in like a virtual waiting room. We'll talk about some telehealth stuff as it relates to this in just a moment. Maybe it is also sending secure messages back and forth, whether it's to my billing teams, maybe it's to my clinical teams. It could be a lot of different reasons. We want to basically give the tools to the patient. So this way, it's one less phone call that we have to deal with, maybe one less email. It could be a lot of different things depending on your workflows, but we're trying to take as many tools as possible and give to the patient. And as we go into this, we have to acknowledge something very important. I should have really started with this here. Is I understand and I expect that between generations, there's different levels of expectations, right? Our elderly patients, adoption rates, probably not the highest, different reasons why that could be, but what they're expecting to use is probably what I'm going to call the bare minimum, right? Maybe they want to send a secure message. They probably want access to their medical records. There's going to be a few other important things that are going to be on there. But as you advance forward into like our millennials of today, they're looking for more. They want to self-schedule. They want to pay their bills online. They want to fill out an intake form. The last thing that they want to do is sit in our waiting room and filling out paperwork that they could have done on their phone. So as we go through that, I have all different offices being represented today. Think of it, what it means for your patient demographics and how can we assist them? And you're going to see all different kind of options with that. But understanding that there is an expectation not only amongst patients, but within that, within their generations, that's very important to understand. Kind of taking that one step forward, I found this very interesting. Patients that are aged 18 to 24 years old, so our younger patients out there, they were 3 times as likely to consider switching doctors if we didn't provide them a more digital experience. 3 times. That's a huge number. So think of that. If we don't offer them a portal, we don't offer them online bill payments, if we don't offer them online scheduling, they're 3 times more likely to go somewhere else. That's something we need to solve. And again, we're going to see some of that when we go through the product here in just a minute. Now on the other side, from our kind of elderly population, we do find about half of the patients use the portal. I say about half because it changes amongst age, but you'll see patients that are 65 years and older, about 55% of those patients use the portal. If they're a little bit younger, 50 and older, about 58%. And what we're talking about again is all these things that we're talking about in the portal: scheduling, televisits, consents, intake forms, bill payment options, right? Access to our charts, access to lab results. We're empowering the patient. That's the whole point of today's call. Kind of falling into that, and this just kind of takes a little bit further. When I talk about intake form collections, talking about maybe a medical history form that we can put online, right? Again, whatever they fill out, it's at their fingertips and now goes directly into my system. Instead of having them fill it out on paper, give it to my front desk, verify it's filled in, scan it in, maybe then translate it into my EMR. That's just a lot of steps, right? The patient can help us with that. Consent signatures, right? Maybe we can have our consents online. If we're still looking for physical signatures, maybe they print those and fax them, or maybe they print them, scan them, and send them back to the portal. There's going to be a lot of different options there. Uploading insurance cards, driver's licenses, just kind of any identification really. Think about it, what we do today. Patient comes in to the check-in area. They're going to hand us those documents. Let's just say a driver's license. Check-in person has to go to the scanner, scan it in. That's going to take a few moments of time. We also have to hope that that piece of hardware doesn't break on us, because that happens every so often. Then associated to the patient, it's a process. It works, but it's a process. Whereas using a portal, you can just do it themselves. So this way, when they show up at time of check-in, it's all there for us. Now we can just review it real quick. Probably today, in my opinion, of all these different things that we're talking about, I found this one the most interesting. 63% of patients said that waiting for their provider was the most stressful experience about going to an office. I find that most interesting because I think we all know this. Waiting for our providers, that's just kind of part of life, right? Whether we're waiting in our waiting rooms, maybe in our exam rooms, could be somewhere in between. But 63% of patients said that was the most stressful part of the visit. So if that is the most stressful part of the visit, why don't we introduce something like a virtual waiting room? So instead of sitting in our waiting room, maybe instead of waiting in the exam room, they can wait online through their phone or through their computer, and they can wait in the comfort in their own home, excuse me. So again, 63% of patients find it stressful. We can fix that. We have tools already today. What you can also do using a waiting room is offer tools like this. You know, as they're waiting, they can communicate with you using that secure messaging. If you think about it today, if they're waiting in your exam room, they're just kind of stuck by themselves waiting. And it could be for minutes, it could be hours, kind of just depends on office workflow. But they have no way to communicate with the outside world with us. Now they can. Using this virtual waiting room, they could virtually say they're here, right? We need to know how do we know we're waiting? And you'll see when I get to our actual portal, there's going to be like an I'm here option to alert the staff that they're actually here. That updates the schedule as well, just like what you're probably used to in current practice management, is that when the patient's here, you probably mark them as in or as arrived or something similar. Probably updates your schedule to indicate the rest of the staff they're here. Let the patient do that. They can mark themselves as here, and it will update your schedule. So this way, virtually, you can see they're actually waiting for you. So these are, again, different kind of choices. Now that we're seeing some things that the patient can do, and also really was expecting, how does that relate to the practice? How does it relate to staff productivity? I think some of these we probably already started to allude to, but let's kind of dive in a little bit deeper with them. First things first is we found, and I think this was probably a common factor here, 80% of patients said they would choose providers just based off of pure convenience. I think that makes sense. Convenience can be a lot of things. But as it relates to portal, right, if we can solve that initial statistic of 63% of patients are stressed out waiting, we can fix that. I assume that means we're going to be seeing more patients and happier patients too. We're going to talk about that in just a moment. From a staff productivity standpoint, these are the things that I was talking about. And a lot of them we started to allude to earlier. The first thing is we can move that kind of check-in experience out of the check-in area and now onto the portal. So patients can go online and do their own demographics. They can fill out their own intake information. They could possibly pay for any time of visits, whether it's deposits, it's co-pays, it could be anything. We'll see more of that in a moment. Patients could also schedule their own appointments online. So maybe that's something you do today at the checkout area for follow-up appointments and put that online. Maybe today that's also done over the phone, right? How many minutes of a day are we spend on the phone dealing with something like this when the patients can do it themselves? Kind of relates to the next point. Patients now would have access to their medical information. Have to think about all the calls where we get requests for their medical information, where we have to gather it up, probably print it out for the patient, maybe put it on some kind of digital drive. Patient comes in and then we physically hand it to them. That could be all done online. And then also just what I had mentioned before, patients can pay their bill online. Why is that important from the staff perspective? Since that's what we're talking about here, is we can send out maybe one statement. Patients get that, they go online, they pay their bill, it posts the payment and applies it to the balance for you. Patient also gets a receipt automatically. We think of all the steps that would have taken of if the patient, let's say, mailed us a check, to get the check and open up the mail and then post it and apply it and send a receipt back, we would save tons of time using something like this. Also related, and this falls both under really patient and staff productivity, but we can utilize things like telehealth through the portal. So what does this mean for all of us? Using telehealth, you obviously have a decrease in exposure both on the patient and staff side, because now we might not have as many patients in our physical waiting room, but we're going to be seeing them virtually. In theory, this also improves patient experience, right? We just were talking about that patients get stressed out waiting. What happens to stressed out patients? Do they just sit there and just kind of mind their own business? I doubt it. They're going to open the door, they're going to find our staff, and they're going to let us know that they've been waiting too long. They're upset, and then they should be. So we can have them not be as stressed through like a thing like telehealth. It gives us more time to focus on other items. Big thing too is the patient portal. I'm not sure everyone who's joined this call, but if you all remember, patient portals were originally really designed years ago due to government compliance. Nowadays we call this MIPS, but in the past it used to be called meaningful use. They really came about from there, especially in our specialties. And over time they have evolved, right? Originally, it was just for the government compliance. It usually meant you have to provide certain type of documentation for them. Secure messaging was part of that government compliance as well. But now what are we talking about is that they can go online and schedule and bill pay and update their records. They can do a lot of different things they couldn't do before. Originally, patient portals, again, more of that government compliance, that EMR only type feel. Today, it's a full solution. So we want to talk both about practice management and EMR items. So speaking of which, how does this relate to payments, right? I mentioned online bill pay. I mentioned time and visit payments. I mentioned like receipts on the portal. I mentioned a lot of things, but let's kind of see more about that. And what we had found is for our smaller offices, smaller as being defined as less than 5 providers, about 80% of those practices found that payment collections or payment accountability was their second largest challenge, second largest. So that's probably a lot of us on the call today. We probably struggle with this, whether it is, getting those statements out the door, dealing with collections, dealing with just payment plans and collecting of money. It's a very important thing. Most of us struggle with that. How can we help? It's going to be through digital payments. And what we found, and I find this very interesting, is digital payments has been here for a while. It's nothing, brand new, but I really started my research from just 4 years ago. And what I found personally interesting is 4 years ago was, yes, it was 2017. It feels hard to say those words, but in 2017, it was found that 68% of patients who wanted their healthcare providers, they wanted digital payments. 68% back then. So let's say almost 70% of our patients wanted digital payments, whether they had them or not, they wanted them. From there, we found 3/4 of the patients said they would pay quicker if they have more options. So I find that interesting because a large portion of patients in 2017 said they want more options. They then said, yeah, if you give me more options, we'll pay quicker. Not really sure why we wouldn't kind of enact that. There must be some other reasons going on, because then look what happened in 2019. 81% of patients are now demanding online payment options. Huge number. I haven't seen what it looks like for 2020 yet, and a lot of that's probably changed due to COVID. I imagine these numbers are even higher than what we see here. But 81% of patients said they want an online payment option, and essentially 3/4 of them at least said they would pay their bills quicker if we provided that to them. So when we talk about staff productivity, we're saying reducing or eliminating the need for patient follow-up and hounding them for like collections and statements and collecting payments. That's what's being claimed here. A lot of my patients will pay on the first time through. Now, that was online bill pay is what I'm talking about. What's important too, because a lot of systems out there offer an online bill payment option. We're not the first one. I don't want to take credit for that one. Online bill pay is being defined as patient comes in, we see them as part of their encounter or their visit. After their visit, we have a balance that needs to be taken care of. This is talking about paying it. When I'm now referring to here of collection of payments ahead of time, I'm talking about what's due at time of service, talking about their co-pays, talking about those deposits we might collect prior to their visit, talking about co-insurances. There's a lot of different things. This is a very important thing to kind of draw the line in the sand from, because with online bill pay, we have a balance, right? We've seen the patient, we've done the work, now we need to collect our money. But payments collecting ahead of time, we're essentially talking about prepayments because the visit hasn't happened yet, although it's about to happen, arguably. But we like to draw the line in the sand because from a financial standpoint, they mean two different things. So using something like NextSix Patient Portal, you can do both. And we'll see that also in just a little bit. Now, with online payments, and I think I kind of alluded to this already, is we found there's been a 21% reduction in patients sent to collections after a practice has adopted a portal. 21% of patients. So that means, let's just make up a number here. Let's say that we're sending 10 patients to collections a month. We're adopting a portal. We're reducing that to about 7 or 8. Big change. What does that mean from a staff productivity standpoint? I can now focus on those other patients that are still going into collections. I can focus on other tasks that maybe I've been ignoring this entire time. Essentially, adopting the portal somewhat resolves itself naturally by giving the patients more choice. So a lot of important things here. And last but not least, before we start to look into the actual product itself, is that we found that once people are exposed to something new, whether in this case a new patient portal, could be new payment options, they're not going to step back. And I think that's kind of common, right? Anything that we introduce new as a society, we're never going to step back. But the reason why I wanted to call this out is for those offices that maybe have not adopted a patient portal yet, or maybe they haven't adopted a new payment processing method through the portal. Think of it this way. If you were a patient and you went to a provider's office and they had these functions, now you went to another provider's office, you're going to expect that, I hope. That's what's happening to our patients today. Is they're going to other providers' offices, and slowly but surely, these options are becoming available. They're getting exposed to them. And the reason why they're expecting it is because they've used it already. Nobody wants to take a step backwards once we've kind of seen the good parts of these things. So that's something very important to think about. Now, with that said, as I promised, let's do a quick walkthrough of the product. Just as a reminder also, as I promised, once we're done with the product side, I'm going to open up for live Q&A as well. So if you haven't already, start typing out any questions that you might have relative to the portal in that GoToWebinar questions section. And then when we get to that point, I'll start looking through our questions there and hopefully give some good answers. But without further ado, when we go through the product, just wanted to remind you of this slide really fast. You're going to see me doing things like scheduling. I'm not going to go through televisit only because it's just myself on the call today, but those are going to be options. There's going to be options for filling out like intake forms and bill payments and accessing chart notes. You're going to see a lot of that today. I'll try my best to kind of touch on a little bit of each. The big thing with the portal too, as I go into this, with NextTech's portal, My Patient Visit as we call it, it can be accessed in two different platforms. One, the patient can download their own phone app, available both on iPhone and Android devices, and they can do everything that I'm about to show you. Or you can also do it just through a website through just called mypatientvisit.com. What I'm going to do for everybody on the phone, I'm going to walk you through the phone app first, then I'll switch gears and I'll show you the website second, so we can kind of see how that looks. Now, for my purpose, let me go ahead and switch my screens to the phone. We should see that here in just a moment. All right, now that we have my phone pulled open, let's look through what the patient would experience on our patient portal as if they were using the My Patient Visit phone app. So in this case, this is going to be on an iPhone, but remember the same application is also available on Android devices as well. So first things first, let's go ahead and open it up. I'm already registered as a patient, so I'm going to go ahead and log in as myself, and let's see what options that we have. Now, what happens in this particular case, I am actually a patient to more than one practice. So from the patient experience, I get to choose what practice I'm going to be going into. So I'm going to choose this Gulf Coast Eye Associates today. What we'll see right away, top left of the screen, my patient currently has an outstanding balance. I'll kind of take through what that means from the payment processing items, like what we were just talking about just previously. You can also see that my upcoming appointment is just really quick from now. It's at 5:45 today. And it's a telehealth visit. So you'll notice that there's a join button. Right now it's grayed out because it's not quite time for my visit yet. So we don't want to have the patient join too early and just kind of wait there. Patient could also go ahead and pay essentially what's due at time of visit. That's where we'll see that $50. I'll take you through that also in just a moment. We'll see on the top left, patient also has options in here to do things like upload their own identification cards, their driver's licenses. They could even come in here and choose to fill out a form. So in my particular case, I have a clinical intake form readily available for me. I'm gonna go ahead and open that up, and it's gonna start right where I left off. And what happens here is, based off the form I fill out, it will go directly into your EMR system. So this is just an example, but you'll see it's mostly checkbox oriented to make it easy for the patient. And most importantly, this data goes directly into your EMR for easy review. If I go back for just a moment, what we're going to see then is I want to talk more about that payment processing. So we saw it in kind of two places. One is on the top of the screen. This patient had a very large balance actually. The other one is more in the middle of the screen, referring to what's due at today's visit. And what's unique here, if I choose to pay now that $50, what's going to happen is it's going to go ahead and prompt me and says, all right, well, for today's visit, I'm going to be expected to pay at least my copay of $50. This particular patient, you'll see the next line item has an account balance, so it's very large. The patient in this case could come in here and maybe they are going to be paying, let's say, $250 additional dollars. They can go ahead and add that onto their screen here. So in total, they would be paying $300. And of course, they would add their credit card information. And then most importantly, they would be able to submit this and it goes right into the practice management system. Now that we're seeing these features, what I'm going to do is go ahead and switch my screen. We're going to look at something pretty much the same, but more on the desktop side in the event the patient didn't download a phone app. So now that we switched to the kind of more web-driven, the desktop version per se, just going to a website essentially, we can now see the exact same patient portal that we were looking at just a moment ago. Very similar choices, if not the exact same choices. I'll take you through those in just a moment. But there will also be some additional options too that we should be talking about as well. First things first, just to compare, you'll see on the left-hand side now is here's my upcoming appointment. Still can do the do at time of visit. Again, I'll show you kind of what that looks like in just a moment. You still have options to join that visit online if it's a telehealth visit when it's necessary for the appointment to occur. We now have options to also confirm my future appointment if I haven't done so already, which it looks like I have not. You'll see further on the right-hand side, also some more similarities, the ability for the patient to upload their own insurance cards and identification cards. Still for kind of the similarity parts, we're able to come in here and as a patient, fill out that same clinical intake form that we were talking about just before. Here's the same form. And when I go ahead and hit go, it's going to be the exact same thing, same functionality that as I fill out anything in here, it will go directly into my EMR. So now from a patient experience, it should be very simple to select a few checkboxes instead of typing things out. And then more importantly, from our side, from a review standpoint, it's now in the EMR. So that will certainly save us some time. What we also do have options for as well, just to kind of point out, is you may have noticed this within the chart section, a patient will still get options to review any documentation that we've uploaded for them. They do have options to securely message us and we can communicate back to them if necessary. The patient could just upload any additional documentation that they feel necessary for. They could also come in here and do things like look at and potentially edit their demographic information. So you'll see here some kind of examples that's going on here. Now, what's real nice with this is that you do have control within the system as far as what they can and cannot do. You'll see a hint of that because if I go into my insurance information, I personally do not want to have the patients update their insurance information, especially since we run eligibility within the software. You don't really want to have the patient change their policy ID by mistake. So you'll see in mine, when I hit show details, it's all grayed out because it's marked as read only. So it's kind of the nice thing is that the patient can still verify and view it, but more importantly, they can't touch it. Now, if we go back to that dashboard a second, just to show you that payment processing item over here on the bottom left, still the same thing we saw before, right? Patient can go ahead and pay that copay of $50 we talked about. As far as the visual standpoint, we'll see when we choose it, go ahead and says, do you want to pay at time of visit? You want to do the time of visit plus the account balance, or maybe the time of visit plus a partial balance. And that's kind of what we were just doing on our phone, where I had this chosen and we were keying in essentially a number. We did 250 just a moment ago, and we can then see the total payment from the patient perspective. What patients could also have the option of doing is you'll see up in the top, they could request their own appointment information. This is a pure request, and what I mean by that is nothing is necessarily being booked through this method, but it's essentially just a general request, and you're going to see where I can do things like choose, let's say, a provider, choose a location. In this case, I have a few locations in this practice. I can choose my reason for visit. Again, the time of day is very general, right? We're not talking about any specifics. So maybe the patient wants to be seen on a Monday and Tuesday afternoon. What this does is it requests it, it sends an alert to your staff. So this way we can go ahead and book that or call the patient or message them. Kind of just depends on what your individual workflows are. But again, going back to that main dashboard just to confirm, exactly the same content as far as the phone app is concerned, different look and feel, right? So for our offices that have an elderly demographic, they're more than likely to probably use this web-driven as we see it here, whereas maybe our younger populations might have their phone app installed. There's some really nice things with the phone app because if we as a practice message the patient, they will get an instant alert. Whereas on the kind of web version, they're going to get an email to remind them to check it. So just a little bit different from the technology standpoint. So with that being said, now that we've seen the portal both now on the what I'll call desktop version and also the phone version, let's do this. I think it's now a good time now that we've kind of talked about portals, we've seen the portal. Let's go ahead and transition like what I had mentioned earlier at the beginning of this webinar. Let's go ahead and go to live questions at this point in time. All right, excellent, excellent. And just as a reminder, let's use that GoToWebinar questions section. I'll give everybody a few moments of time to start collecting their thoughts, go ahead and put them into the questions. In a moment, I'll start kind of going through those just to see what kind of questions everybody has. As a reminder, this call is really a high level discussion. This way we can talk a little bit about everything. But it's definitely an offer out there that if we'd like to do a deep dive discussion on the portal or any of Nextech products, definitely welcome to do so after this call. So with that said, let's look through some of our questions. The first question is can you send patients their medical records electronically? Yes, that is definitely an option to do. You can make it that as soon as one of your notes is signed off on, it can automatically be uploaded to the portal, and then patients could download that and print it and arguably do anything that they would like to do with it at that period of time. Second question is, it says, is the My Bill Pay function using the credit card portion of the system, or is it some other type of ACH type of payment system? The answer is it is part of our credit card solution. So just to go into that a little bit more detail, Nextech now offers payment processing through Nextech, which means we're the ultimate merchant service. It does open up doors for My Bill Pay, that's just being discussed on the portal. It also does open up other doors as well. We can kind of dive in deeper on another call, such as payment plan postings, saving credit cards on file, even taking credit card payments over the phone, like card not present options. But that would be all part of the payment processing side of things. So you are correct, it would be on that side of things. Let me go a little bit further, just kind of weeding through, because some of the questions we're getting, and this is perfectly okay, kind of all relate the same. So I'm going to try to do my best to answer as many questions as we can. One question came in here. It says, we have Mac computers. How do we set up secure messaging to patients? Great question, and it's a very simple answer, actually. The secure messaging is built within the platform of Nextech itself. So as long as you can access Nextech, you don't need anything special. It's all built in within it. And we offer different kind of offerings for our specialties out there. We can always go into details with that. But the fact that we're using a Mac should be somewhat irrelevant of that discussion of talking back and forth to the patient from the portal. Other questions come up in here, all related to physical signatures. And I see it listed a few times, such as, do we have any experience or support for things like DocuSign? How do you capture physical signatures? There's kind of an overall theme here, and I'll answer that. So on our portal today, what happens is if we present the patient with a consent form, let's just say a HIPAA consent form. Today, what happens is at the bottom of the consent form, we're giving the patient essentially three things to fill out. One is saying, do you consent to what you've just read? That's obviously most important. Two is it's going to ask them to physically type in their first and last names. And three is going to be dated. Today, it does not support something like a DocuSign. Definitely aware of what those do for us. Today, essentially, the workflow is we're going to collect that. And then if we feel the need to collect the physical signature, we would do that in the office because the EMRs we have support physical signatures. So whether you do that on an iPad or maybe a Topaz signature device, it would be something like that. Moving a little bit forward, it says, it looks like this office has quite a bit of different appointment statuses. They want to understand how do we designate that to have an I'm here option. Now, what's important is I'm going to defer this a little bit to our support team because I think there's something unique with that practice, but I'll give you kind of a general answer. The I'm here option will come up automatically if the appointment is same day. So obviously I can't choose I'm here for an appointment tomorrow, right? That wouldn't quite make sense. The patient would get this option. And then what happens is when we choose it, there's actually a new status that's auto-created for you. You don't have to do anything from a setup side in your system. It's a virtual I'm here. So you mark it, it will change the color of the appointment, and there is set up to that piece. And if you're using something like our IntelliChart Pro system, it will automatically place the patient in the virtual waiting room. You do not have to make that waiting room. It will automatically appear the first time the patient uses it. And again, our support team can go into more detail on that one. Let's go a little bit further here. Again, trying to just answer as many questions as we can. Here's another good question related to the online payments. The question is essentially, they use CareCredit today for prepayments of surgical fees. Does that interface with the system? I'm going to give you a somewhat short answer, although I believe this is going to deserve a slightly longer one. The shorter answer is the online payment system will work with any of the major credit card companies, Visa, MasterCard, Express, Discovery, things like that. With CareCredit specifically, if the patient has an actual credit card that has the Visa logo on it, then this completely works. If they do not, then the patient wouldn't be able to pay their bill or prepay their surgical fee online. And again, we can kind of talk about that maybe on the side, what that means for us here. Next question is, does NextSec offer support for any of this in the case that there's any issues? From the practice side, yes, right? That's our standard support side. From the patient side, no. The reasoning for that is from the patient experience, they kind of shouldn't care that you happen to be using NextSec, right? That's our great practice management EMR system, but from the patient standpoint, it's somewhat irrelevant. From a workflow standpoint, two things. Well, really three things. One is if the patient doesn't know how to log in, maybe they forgot their username and password or something like that, there's actually a function within it that will walk them through how to retrieve that. It's going to ask for their name, ask for like date of birth and things that would happen how we would normally forget our passwords. We probably ran into those situations. Also too, and I didn't point this out, but I think it's important, is when the patient is in the portal, on the bottom right, there's a built-in question section right there. And there's walk me guides. So if they want to learn how to do something, they click on that and we'll walk them through that. If the patient still needs assistance, and that's okay, the expectation is that the patient would then call your office in this particular case. They wouldn't call NextSec directly. So let's go a little further here. So the question is actually, essentially, how does this, or is an EMR required, I guess would be probably the easiest standpoint. Short answer is yes. So even though today we were talking about a lot of like practice management functionalities such as online bill pay and scheduling and demographics, right? We associate that to practice management. Our EMR really kicks off things from a account creation type thing and also the intake form. So you actually do require the EMR first. That's the most important piece. If you add on the practice management, great. That's exactly why we're talking about things today, but you do have to have the EMR, just to be clear. Let's go a few more. I'm going to answer, let's do maybe like 2 or 3 more here. I'm trying to just go through the list and pick out some good ones here. Next one here is, how do you schedule a virtual appointment or a telehealth visit? I've seen this kind of worded different ways throughout our questions. Very simple. Within your system, all you have to do is make sure you have an appointment type that has the words telehealth. That's the keyword, telehealth. After the word telehealth, doesn't matter, right? If you want to call it telehealth visit, telehealth appointment, or just plain telehealth, that is fine. Once the EMR recognizes that, the patient will see the join online option within the portal, and then we can always kind of talk about how the actual telehealth visit works on another call. But scheduling as telehealth is important. This also relates to the previous question of why is an EMR required? because you can actually schedule your telehealth visit in your practice management system that is not Nextech, possibly. That information will go into our EMR, which then triggers it to be an available option. So to be clear, the portal and telehealth can actually be done on EMR only. You do not need the practice management for that piece. Let's go a couple more here. I know I said 2 or 3 more, but I'm going to try to go through. There's a lot of good questions on here. Let's see. Let's do this one. How does the patient information be put into the patient chart from Nextech Cloud? So this is a specific question relative to that software. How does that info get verified, essentially? So maybe a bigger question here is, we're saying the patient can go online and essentially do something. How do we know what they did? I'm going to kind of simplify that question to that point. Simple answer. What happens in Nextech Cloud, and also for those users using our Practice Plus system, that's our other practice management system, is when the patient goes online and fills out, let's say, their demographics, inside Nextech Cloud, in the top right of the schedule, you're going to have what's called an appointment work list. Essentially, you get to filter it down by provider and date ranges and things, but most importantly, you'll see all the patients coming in and what have they done and not done so far. In Practice Plus, almost the same exact idea, but instead of calling it an appointment work list, it is called the intake work list. Under either scenario, when patients finished online, you get to see it. So this way, what's important is when they come at check-in, if you're physically seeing them, we can pull it up and maybe just review it real quick with the patient and say, hey, is this what you typed in, before we kind of move forward. So again, appointment work list on the Nextech side and intake work list on the Practice Plus side. I'm going to do two more, I think, maybe 3 if we're lucky. Let's see. One question comes in here, also in regards to the financial bill pay. Essentially, it's asking, can patients review their statements online? Answer today is no. So today, what they can do is pay their bill online, so I can see the total cost of their bill. Can't see their statement line item breakdown, not today at least. That is something that we're working on internally. I don't have much more information to share with you at this exact moment, but today it's going to be their full, essentially, bill balance. They could pay that, and then if they need their statement, you can certainly upload it to them using the portal. It's not going to just automatically be there for them, so that's going to be important. And then let's do this last question here, because I've seen this kind of asked in different ways, shapes, and forms, and I think it's important. Essentially, the question or statement is that a lot of practices that have been using the patient portal, they've been getting phone calls from patients that as they've been going through their medical history forms or kind of other lengthy documents, they've been getting calls from patients that they're getting kicked out, or something's happening there. There's kind of the questions worded all different ways there. And what's happening ultimately is the question. So with My Patient Visit, that is correct to an extent. That if you leave the web page open and don't do anything for a period of time, I believe it's like 5 minutes, the system will prompt the patient and it gives them 180 seconds. It gives them 3 minutes to either click, hey, I'm still here, or no, go ahead and log me out. If the patient doesn't click anything, it will auto log them out. So in the event the patient's filling out their medical history, maybe they walk away to go look at something and they walk away for more than basically 8 or 9 minutes, yes, the system will auto log them out. It would be in the best interest of the patient to either save their work before that happens, or hopefully, not be able to walk away for more than that 8 or 9 minutes. But that is a security feature that is done on purpose. That's really for HIPAA privacy. So I'll leave that question as our final question. Again, though, our team will be reaching out to everybody that joined today's call. I do want to be able to answer more questions. There's plenty more on this list here. I do want to also offer the opportunity to get on a live call and maybe talk about these questions, maybe even look at the practice management or EMR, depending on the situation. So for now, you will be hearing from us in the future. I thank everybody that joined the call. I'm a little upset I didn't get to answer all these great questions here, but there's a ton of them. Again, thank you so much on this kind of Tuesday afternoon, and we'll be in touch. Thanks all.